Hey everybody, so today I'm going to be going over some practice questions for the Nremt. So a lot of people will struggle with this. They'll take the test a couple of times, fail it. They'll think they know a lot, but if you stop what you're doing, if you stop doing practice questions, you get a piece of paper and you write down some basic information that you should know in EMS, you might be surprised at how little you know. So I'm not going to try to help you call it out. I feel like this is going to be really effective. There's only going to be 3 questions that we're going to go over, but we're going to go into them in great detail, and I think it's really going to help improve your pass rate. So, really quick before we start, do you know what your baseline vitals are? What about the medications you can push, the O2 settings you can use for your airway devices? Do you know all of these? Probably 95% of you that are watching this is saying, yeah, I know this. This is really basic. Come on, let's move on. I would like for you to pause the video here. If you want to pass your National Registry, pause the video. And I want you to get a piece of paper and write down what you think the baseline vitals are for blood pressure, heart rate. You should know all 6 of them. And technically, you can maybe argue that there's one more or so, but realistically, those are your 6 baseline vitals. And now, afterwards, I want you to write down the name of all the medications that you can push. May seem like a lot. There's probably like 30 or 40 if you're a paramedic. If you're an EMT basic, it's like 10 or so. Do you know these medications? What about the O2 settings for your airway devices? When do you use a nasal cannula? When do you use a non-rebreather? When do you use a bag valve mask? Do you know this? If you don't know the answer to these 3 basic questions, then you have no business passing the Nremt. You have to be honest with yourself and recognize this and then learn from it. So, we're going to go over just the baseline vitals for this. So, for the baseline vitals, different texts are going to tell you different things. Always go with what your instructor says, but this is kind of how I focus on vital signs. So, we have like the blood pressure here with the systolic number, the top number being from 100 to 139 being in the normal range, and for the diastolic number being less than 100, it's generally considered normal. For the heart rate, anywhere from 60 to 100 beats per minute is considered normal and just a sinus rhythm. For SpO2, generally greater than or equal to 95% is good. A lot of texts have been leaning towards 94% now, but I guarantee you, if somebody's having a breathing problem in a National Registry question, they're not going to be satting at 94%. They're going to be satting at 91, 88%. Can they breathe on their own? Can they not? Then we consider non-rebreather, a BVM, nasal cannula. You'll have to be able to distinguish the difference. For your respiratory rate, what the setting or the rate should be between 12 to 20 breaths per minute. For the temperature, you would generally want to go for 97 degrees to 99.4 degrees Fahrenheit. Sometimes text will say if it's equal or past 99 degrees, it's a fever. But if you try to Google this, no one's giving a good answer. These are generally just how I like to look at these type of vital signs. So a lot of new text is saying that 70 to 120 is considered normal for blood sugar. I've always been taught that it's 80 to 120. But if you have somebody who's hypoglycemic or has low blood sugar, again, I guarantee you the national is not going to put it at like 75. More than likely, it's going to be at like 30 or 20 or maybe 40. And then you have to ask yourself, am I an EMT basic? What can I administer then? Am I a paramedic? What can I administer then? I'm not going to say it, but you need to know it. So some say 70 to 100. I always like to go for 80 to 120 personally. So for basic vital signs, again, here's another just rough estimate of the general vital signs. I would try to make sure I know this before I even move on with the video. You're going to need to know this for your national. Imagine trying to take your national and you didn't have these answers correct, and I hope you wrote it down on a piece of paper to call yourself out on it because you probably didn't know this. At least not all of them, especially if you're a basic. So, moving on to the first practice question. We have a 36-year-old male patient who is outside on a clear day walking his dog. The patient has a yellow shirt on and has been walking for about 20 minutes. Today is March 5th, and as he began his second lap, he started to feel chest pain. The patient is currently sitting on a park bench. His vital signs are as follows. Blood pressure is 96/54. Heart rate is 102 beats per minute. Satting at 96%. Respiratory rate is 16 breaths per minute. Temperature is at 98.3 degrees Fahrenheit. And finger stick blood glucose is 136. That's just their blood sugar. The patient normally takes atorvastatin, lisinopril, hydrochlorothiazide, metformin, and glyburide. You determine he has no known drug allergies. What medication should you administer? So this is a really long question, right? We have these answer choices: nitroglycerin, oral glucose, aspirin, and oxygen. So this can go anywhere from an EMT basic all the way up to the paramedic level. But we have to look at these kind of questions and we have to ask ourselves, well, what's the crap in this question, right? What is the useless information that they're putting to fluff this in? And at the same time, where can we look at this question and start to distinguish, like, hey, this is really important information. Hey, these vital signs are off. You're going to see that they have some vitals here. They have some very important parts of the question, like the chest pain, for instance. It's a big glaring factor in this question. Also, the activity that he was doing, and they even have the medications that the patient was taking. So sometimes you're going to be taking these test questions and you're going to realize, hey, like, I know some of this. I know what my baseline vitals are, but I don't know anything about atorvastatin, lisinopril, hydrochlorothiazide, any of these medications. That's okay. You're not going to know everything that's on the NREMT. That is completely normal for these tests. But the more you know, the less cloudy this question gets. At the same time, knowing to cut out the nonsense is really important. And we're going to go over that next. So, we need to cut out the nonsense. Who cares about the shirt he's wearing, right? So if we look back here, he has a yellow shirt. Who cares? It doesn't matter at all. Who cares about the date? I think I mentioned the date here, March 5th. Unless you want to get extremely specific about dehydration, hyperthermia, hypothermia. So I'm talking about like winter, summer months, blah, blah, blah. That does not matter for this type of question. These parts of the questions are there to distract you. You have to teach yourself how to cut out the nonsense and slowly piece together what the answer may be. So there's some garbage in this question. That's here just to throw you off. So looking back at the question, I've already looked back at it before. I encourage you to pause the video again and tell me, where do you think the nonsense is in this question? What can we cut out, right? So personally, outside on a clear day, it's not really that relative or like really important. The yellow shirt, the date, yeah, he's been walking for about 20 minutes. It's not really too important. Okay, he's beginning his second lap. The really important thing is that he started to feel chest pain, right? While walking his dog. That's very important. So we cut out some of the nonsense now. So we have a 36-year-old male patient who's walking his dog, and as he began his second lap, he started to feel chest pain. We have the rest of the information, the vital signs, blah, blah. Now I need to ask you, again, to pause the video if you can. Look at his vital signs. What is wrong with his vital signs? I want you to pick every single thing that's off with his vital signs. Okay? So, we look at the supporting text. Starting to feel chest pain is extremely important here. What else is important? Well, we have the vital signs here. And if we move forward, looking back at our basic vital signs, I'm just going to move through it. His blood pressure is low. He's presenting as starting to become hypotensive. He is hypotensive right now. Some texts, they might argue that 90 is still within the normal range. But with the guidelines we're going for, we're going to say this is starting to become hypotensive. His heart rate's a little bit elevated, and his blood sugar is a little bit above the normal range. Okay, so that's relatively significant, right? At the same time, we can ask about these medications. Now, if you have a medical background in the past, or if you've ever touched up on it, that's great. You can use that to help you answer these questions a little bit better, right? So you can see here he takes atorvastatin, lisinopril, hydrochlorothiazide, metformin, and glyburide. What do those medications do? So I'm not a physician. These drugs may have secondary effects not noted. This is only for educational purposes. But atorvastatin generally is to help you regulate your cholesterol levels. Lisinopril is used for blood pressure. Hydrochlorothiazide, this generally is paired with a blood pressure medication like lisinopril, and it's used as a diuretic, just to remove excessive fluids. Metformin and glyburide, you should think of these as diabetic medications. These are oral diabetic medications. Oral means via the mouth that you can take to help regulate your blood sugar, which makes sense. I mean, look at this guy's blood sugar. It's a little bit elevated. It's at 136. Maybe he just ate right before he went on the walk. Who knows? Okay, so we have our 4 different answer choices here. Now that we're piecing everything together, we have nitroglycerin, oral glucose, aspirin, and oxygen. Now, just by looking at that it's chest pain, the answer should be glaring out to you what it could be. Maybe you could cut out one of the answer choices that are obviously wrong and then move from there. So you might think that there's a good answer, a better answer. We're going to go over it in a moment, but please pause the video and I need you to answer this and write it down on a piece of paper. Do not just mentally do it, because I'm going to show you the answer and then there's so many students that are just going to say, oh yeah, I knew that. No. You probably were going to pick a different answer until I flipped over. And this is a very basic question. So the answer is aspirin. C. So why is it aspirin? The differential diagnosis you should suspect from this scenario would generally be a possible heart attack. To keep the situation from becoming any worse, quick administration of aspirin is key. If you're curious about the mechanism of aspirin or about dosing, I'm going to leave a link in the description below on just a general overview of aspirin. Why isn't it the other choices? Well, if you're really familiar with your medications, you might consider, if I'm suspecting heart attack, maybe I can consider nitroglycerin, right? So hypotension is a clear contraindication of nitroglycerin. The patient's BP is 96/54. Don't risk it. Do not administer nitroglycerin. Of course, follow your local protocols, but be careful. And aspirin is generally always considered the first line of treatment, even if the patient had hypertension, even if he had crippling chest pain, his blood pressure was 164/78, and he is complaining about chest pain at 10 out of 10 on the pain scale, we're still going to administer aspirin because it's going to help the problem stop the problem from getting any worse. The patient's SpO2 is at 96%. There's no reason to administer oxygen. Some people may argue that you can give supplemental oxygen. I personally think it's a bad idea, but some people argue, well, we need to feed extra oxygen to the heart. I don't think it makes sense, but to each their own. Their blood sugar was at 136. It makes no sense to administer oral glucose. We only consider that if they have low blood sugar, if they're A&O times 4 or an alert and oriented times 4, and if they have the ability to swallow. So administering oral glucose does not make sense for quite a few reasons. Now, we have a practice question number 2 here. So you have a 63-year-old male patient who is involved in a motor vehicle accident where he drove into a ditch. PD is on scene. The patient is verbally responsive to your questions. However, he appears confused. The patient presents with a 1-inch laceration on his forehead with dark blood noted, constricted pupils, and seatbelt marks on his chest. His vital signs are as follows. Blood pressure is 86/54. Heart rate is at 72 beats per minute. He's satting at 88%. His respiratory rate is at 10 breaths per minute. His temp is at 98.3, and his finger stick is at 108. After applying an appropriate oxygen device, seat-collaring and backboarding the patient, and moving the patient to the ambulance, what medication should you consider utilizing? So, really quick, I want you to take a look at this question. I want you to think, okay, where are my vital signs? What are these vital signs showing me? What are important text that I need to note in this question? Where am I in this call? You're not always going to first walk up to a patient whenever you're doing an NREMT question. Sometimes you'll be in the middle of the scenario, right? So in this one, we've given them an oxygen device. We have a C-collar backboard and they're in our ambulance. What's the next thing that we need to do? What medication should we consider utilizing? Because we're already at this part right here. So I encourage you to pause, take a moment, try to make your first guess, and we're going to go over everything. But also try to identify a couple important things in this question, like we did earlier. So now we're going to look at the important information in this question, and there's a lot of it. There's a lot of pertinent info. So right here we can see that the patient was involved in a motor vehicle accident where he drove into his ditch, right? That's very important. The patient is verbally responsive, but he appears confused. His mental status is very important. Dark blood is noted from his laceration, and he has constricted pupils and seatbelt marks on his chest. It's also relative. His vital signs are all very important to know. Knowing what we applied is important, and what medications we should consider utilizing is all important. So this is a very loaded question, right? One big or a couple big things to note. What does it mean whenever we have dark blood noted on a forehead? What happens if it's bright red blood? What's the difference between the two? Right? So we should think of venous blood or venous bleeding. It's not generally as serious. It can generally just be controlled with a little bit of pressure from a gauze. Just taping it up, bandaging it is fine. Also, what about these constricted pupils, right? So I'm sure some of you already, the answer is just screaming out to you on what it is. But what does constricted pupils mean? What does dilated pupils mean? Pupils mess up so many students. So please consider what constricted pupils means, and we'll go a little bit more into it in a bit. So next we're going to move over to assessing the vital signs. So some very obvious bad or poor vital signs right now is his blood pressure is at 86 on 54, so the patient is presenting as being hypotensive. Also, the oxygen level is at 88%, and the respiratory rate is at 10 breaths per minute. You should ask yourself, was I able to identify this on my own? If not, why wasn't I able to identify this when we started the question, right? So these all are fairly negative. Another important thing about this question is that they've applied an appropriate oxygen device after assessing vital signs, right? We're in the ambulance. We can expect these numbers to go up a bit, the SpO2 and the respiratory rate, but what about the blood pressure, right? So with all that being considered, what's the answer to this question? Is it aspirin? Is it naloxone? Is it oral glucose? Is it digoxin? Do you even know what some of these medications are, and why not? So I'm going to go back to the question. Take a moment, please pause the video, select your answer choice, and we're going to go over it in about 5 seconds or so. So the answer choice is going to be naloxone. Naloxone is also known as Narcan, and it's a clear, obvious choice for somebody who has constricted pupils. What would you suspect for somebody who has constricted pupils, a low SpO2 rate, a low respiratory rate, hypotensive? What kind of medications do you think they might have taken to cause this? What do you think is going on with them? What's your differential diagnosis? So we should suspect that this patient is having an opioid overdose. So because the patient is 63 years old, the patient sounds like an elderly individual who might have taken his pain medication and ended up driving. The clear giveaway are the pupils being constricted, as well as the depressed respiratory effort from the vitals and the hypotension. Not every individual who suffers from an opioid overdose is a drug addict. So I've had something similar like this one time where I had an elderly male who was driving and went into a ditch a long time ago. And this individual did not look like a drug addict at all. He didn't look like he was taking pills for fun. He might have accidentally just taken his normal everyday pain medication for his bad back and ended up in a traffic accident like this. With depressed vital signs, administering Narcan can be a quick effect where we can start to see his blood pressure start to increase, his mental status is weakened, and we can start to see that to increase afterwards. Maybe he can become ANO times 4. He might end up vomiting quickly, so if you're a paramedic, you can consider another drug, but I won't talk about it in this video. So you also need to know that naloxone is known as Narcan, so that can throw off some people that might have thrown you off in this individual question. You need to know the different names for a couple of different medications, like Atrovent, also known as ipratropium bromide. You need to know what Viagra is, and then Cialis, and sildenafil. Those are all erectile dysfunction medications. They're important to know. So why isn't it the other choices? Aspirin is generally only indicated if a patient is having chest pain related to a possible heart attack, and there's no indication of that in this scenario. The patient's blood sugar is at 108. Even if it was low, where we would consider oral glucose, which it isn't, the patient is verbally responsive but confused. This is a clear contraindication of oral glucose. If we were to administer this to our patient, they would end up choking and possibly aspirating. In EMS, we can't even administer digoxin. Also, this is an extremely precise cardiac medication that wouldn't fit this scenario at all, right? So, moving on to the last practice question. This one's a fairly simple one. You have a 32-year-old female patient who is in a bar fight 5 minutes ago. The patient is currently laying down on the floor. She is ANO times 4 and grabbing onto her right arm. You see bright red blood spurting out of her forearm. What should you do first? Now, this is a very important question because whenever you take the national, you're going to see that there's good answers and there's great answers. And sometimes you're going to end up getting confused. You're going to argue, why did I get this question wrong? But it's because you didn't do the appropriate steps first. So what should we do here? We're responding to this call. Should we apply a tourniquet? Should we call for help? Should we apply a gauze and hold direct pressure? Or should we check her vital signs? So I'd like you to think about this for a moment. It's a pretty easy answer choice, but please pause the video and don't think about what the answer is. Write down your answer choice and we'll go over it, okay? So I'm going to go to the next part of this in about 3 seconds. So the answer is apply gauze and hold direct pressure on the site. Now, some people are saying, well, if I saw something like this, I would immediately go for a tourniquet. Tourniquet application for something as simple as this? Yeah, you might see bright red spurting blood, and you might want to move to other things. It's not really appropriate. Yes, we can move to a tourniquet, but I think a lot of people, whenever they do testing or they read through the book, they might say like, oh yeah, it's an easy tourniquet all day, blah, blah. But they're underestimating the power of just putting gauze on a wound and holding direct pressure. If you have somebody coming from an engine company that might be assisting you, you might just need him to hold on to it the entire ride, because to apply a tourniquet to the point where it's actually effective enough to stop arterial bleeding, the patient might start screaming at you. They might start ripping at their tourniquet. It's an incredibly painful process, and I'm not saying to test a tourniquet on yourself and to tighten it properly, but maybe watch a YouTube video on it and see just how tight you have to get a tourniquet to actually stop arterial bleeding. Calling for help, you are the help. So I don't believe that's an appropriate answer choice. Checking your vital signs, that's important, but we need to take care of the critical life bleed before we check our vital signs. If this was venous bleeding and it was a small cut, I would check your vital signs before really addressing the venous bleeding. But because it's bright red blood, we should consider this as arterial. So thanks to everyone who made it this far. Yes, we could have gone over like 10 or 20 different practice questions, maybe 50 of them if we had enough time. But we need to make sure that the questions that we're addressing are effective. So if you did like this video, please like and subscribe. It helps out a lot. And thanks for stopping by.